respected Principal, Professor Dr. Solomon Satish Kumar, Medical Superintendent Dr. Prasad Matthews, Dr. Bala Sitaraman, Nursing Superintendent, professors from other departments, dear colleagues, friends, students, a very good evening to one and all. It's very heartening to see so many of us gathered here. And on behalf of the Department of Endocrinology, may I extend a warm welcome to each of us present here. The Department of Endocrinology has been managing the Integrated Diabetes Foot Clinic for more than 10 years. And this is done in collaboration with our sister departments, the Department of General Surgery, Vascular Surgery, Plastic Surgery, the Department of PMR, the Department of Nursing, Prosthetics and Orthotic Services at CMC VELLORE. And each of these departments has played a tremendous role in making the foot clinic where it stands today. And over the past many years, all their efforts and hard work under the leadership of Professor Dr. Nihal Thomas, Dr. Felix, has culminated in this book, which is a comprehensive guide to diabetes foot care. We wish to roll out this book today, and this is in memory of our beloved Professor late Dr. Sunil Agarwal, sir. So without further delay, may I call upon our chaplain, Reverend Pearson, to lead us in prayer.
Shall we look to God in prayer? Yes. Gracious God, our Heavenly Father, we thank you and we praise you for a day like this, an evening like this. Today, Lord, we want to thank you for the endeavors behind all that we do here in this place. Lord, we this evening remember Dr. Sunil Agarwal in a very special way, the life that was lived out meaningfully. But we want to thank you for the book that is about to be released. We want to thank you for enabling Dr. Nihal and Dr. Felix to edit the book. Thank you for all the authors of the articles. We also pray, Lord, that all the efforts that we take will result in catering to the needs of the sick and suffering across the country and even beyond. May this evening be a blessed one to each and every one of us gathered here and those of us who joined online. May your name alone be glorified through all the activities here tonight. We pray this in Jesus' name. Amen.
You can see here. Huh?
Thank you, Reverend Pearson. I recall one of my seniors who passed out from this department. He described the diabetic foot ulcer as foot attack, akin to heart attack. But while heart attack gets a lot of pomp and is addressed with a sense of urgency and gravity, sometimes there is complacency that sets in when it comes to diabetes foot care, and that should never be. So to address this and talk to us about the hidden foot in diabetes, may I call upon Professor Dr. Nihal Thomas. Over to you, sir.
Thank you, Dr. Kripa, and good evening, good morning, and good afternoon to all of you from wherever you are. It's actually quite a poignant moment for me at this point of time to think about Dr. Sunil Agarwal, who was a very special friend to us as a department. You would go through the titles of the talks which come after what I say, and what Dr. Felix is going to be talking about is 0 to 60 to 0 years. And what he really means is, from the time of Paul Brand in 1948, it took about 60 years before we were able to actually set up an integrated diabetes clinic. And there were several people who were instrumental, who helped us out. But I would like to particularly remember people who helped us out setting these things, putting punctuality into place, defining the borders of what we could do in a very difficult area. The foot is an hidden object. It's a hidden aspect of care in medicine. It overlaps and encompasses medicine, surgery, physical medicine and rehabilitation, the nursing services who play a huge role, and the prosthetic and orthotic divisions. So all these put together was a challenge to start with and kind of join together as a congregation. The Hidden Heart actually is a movie which all of you must see. It talks about Christian Bernard and Hamilton Naki. As you all know, Christian Barnard was the person who did the first heart transplant. And he was actually assisted during the time of apartheid by a person who was affected by the apartheid very badly, a black assistant who was actually a gardener. We have here the hidden foot, which has three aspects. Number one, it looks at the aspect of an area which is neglected. The foot is always hidden and neglected. We have people as caregivers who play a huge role. We should fully acknowledge the nurses, the diabetes educators, the prosthetic and orthotic people who manufacture footwear, and the surgeons who come in quickly and move out. And we are left over there, and they do the things which are wonderful as well. I would like to particularly remember at this point of time the other people who have helped us, the administrators and various people who have helped us over the years. More than launching the book, I would like to really mention, because we have had a number of publications and books from this department over the last 18 years. But why is it that we are thinking about this particular launch at this time? Because I would like everyone to remember that this is a neglected area, not just in India, but in every developing country in the world. We need more diabetes nurse educators. We need more prosthetic and orthotic surgeons. We need more surgeons who are interested in the diabetic foot, an area which is mass. And I think you should take this back as a message with all of you, that how you could contemplate and change the world as individuals and as a team over the next 20 to 30 years of your medical careers. Thank you once again for this opportunity. I'd like to thank Dr. Indra Agarwal particularly for coming and being the spouse of a very dear friend who really helped us in the foundational aspects, along with the physical medicine and rehabilitation department and many other areas which have supported us. The PMR department, which is here, Dr. Raji and Dr. Jacob aren't here today, but I think they're coming online. But they have also supported us over many years. Dr. Suranjan, from the very beginning, the basic pioneer of physical medicine and rehabilitation in this institution when it actually came up with the advice that they're given. Thank you so much for attending today, and I would hand over the microphone to Dr. Kripa.
Thank you, sir, for those very inspiring words. It is my privilege to introduce and welcome Dr. B. Venkatesh from the batch of 1978 CMC VELLORE. Sir is joining us from Brisbane. And once again, at the outset, sir, let me thank you for joining us so late at night to grace this occasion with your presence. Sir is currently Professor and Head in the Division of Critical Care at the Princess Alexandra Hospital at Brisbane. Over to Sir to say a few words of tribute to Professor Dr. Sunil Agarwal.
Thank you.
Hello. Yeah, can you hear me? Nihal, can you hear me? You can.
Yes, sir.
Okay. Thank you. Nihal and all the colleagues and friends, thank you for asking me to speak this evening. It's a great honor, and I stand here as not only a close friend of Sunil Agarwal, but also I speak here for the batch of 1978. Firstly, I want to congratulate Dr. Felix Jebasing and Professor Nihal Thomas for bringing out this book on diabetic foot, a comprehensive guide for clinicians. And it's hard to imagine how much work goes into producing a book. The foreword by Professor Boulton, I would encourage everyone to read, and it demonstrates the outstanding piece of scholarship and work that's gone into this production. Chapter 7 of that book is entitled Peripheral Vascular Disease, A Clinical Approach, is authored by two people, one of whom is my dear friend Sunil. It's now 2.5 years since Sunil's premature death. Over this period, much has been said and written about his wonderful qualities by people from all over the world: a loving husband, a father, a brother, an exemplary son, and a competent and compassionate physician. My signal honor today is to reflect on two aspects: my personal friendship with Sunil over a 40-year period, and secondly, his contribution to public life. We first met in 1978. At that time, two people could not have been more different. Socially, culturally, dietary habits, sports skills, orthodoxy, you name it, we were poles apart. Yet we developed an immediate rapport and remained close friends from the time we met till his last breath. In the last 2 months before his death, we spoke almost every day. He taught me to be broad-minded, not to have a blinkered view on life, that people are all different and it was okay to be different, that you could come from different backgrounds, use different approaches, and still achieve your goals. He was very kind and generous. He was there for everyone, and no surprise that everyone in both the men's hostel and the MIQ flocked to his room. Above all, he had a sense of grace and humility. I realized over the years that I became a better man because of him. It's also my honor and privilege to express gratitude for his contribution to public service. One of our prime ministers, Paul Keating, one of our former prime ministers rather, there's a famous quote by him, and I would like to use that, which is: the reward for public life, the reward for public service rather, and public life is public progress. And nowhere is it better exemplified than by Sunil's achievements and contributions. And they're present in the institution today. More than 30 years of service to an institution, heading an independent department of vascular surgery, setting up a well-established and a much sought-after MCH program, training generations of medical students, trainees, and consultants who all benefited from his tutelage. I can still see several senior author publications on PubMed, even in 2021 and 2022, again, suggesting a program of work that he likes to mentor and get people trained. And most importantly, the thousands of patients, both in VELLORE and in several outreach programs that he cared for, whose health and lives have been transformed for the better. Paradoxically, it was during one of those trips to an outreach program that he met with a fatal accident. He was not only a full-time clinician, but he was a full-time mentor and a full-time friend to those around him. Indu, you've been the perfect wife for Sunil, so loving and being the backbone of the family. Varun, Tarini, and Rohan are his pride and joy. And over the last 40 years, he was the port of call for any help or advice. All our children who came to VELLORE for an elective from overseas were looked after by Indu and Sunil. On behalf of the batch of 78, we would like to salute Sunil for his medical, educational, and societal contribution, for his mentorship, and for his humanistic values. His legacy will go on forever. The people who worked with him would change forever. The institution where he worked would change forever and for the better. It's fitting to see a book on diabetic foot, where the fundamental problem is underlying vascular disease, dedicated to his memory. Once again, on behalf of the batch of 78, I would like to congratulate the authors for this wonderful book and wish the Department of Endocrinology well for their commitment and dedication, and wish you all continued success in your endeavors. Thank you.
Very touching words indeed. Thank you, sir. We'll move on to the next session. Dr. Felix Jebasing, Professor, Department of Endocrinology, Deputy Medical Superintendent, And Dr. Suranjan Bhattacharjee, sir needs no introduction, former director, CMC VELLORE, and one of the pioneers of the PMR department. They will brief us on the functioning of the foot care clinic, both here and in the campus at Chittoor. Over to Dr. Felix and Dr. Suranjan, sir.
Thank you, Kripa. And over the next 7 minutes, I would like to brief about the way we actually travel over the last 60 to 80 years, actually. So what does that mean by 60 years is basically, as Dr. Nihal has mentioned, that it's actually when Paul Brand started his work in 1948, and subsequently it took almost 60 years to start our first integrated foot clinic here in town campus. So you can see here, it's a very momental photograph where you can actually see Paul Brand. This is Andrew Bolton, who has written the foreword for this book, and this is Wagner, who is actually has developed the Wagner classification for diabetic foot. So this is a old photographs which show that Paul Brand used to operate on a patient. Subsequently, he goes to the patient's house and make a footwear for the particular patient and empower them to work in the field so that they have their daily living. And you can see Paul Brand in his younger age with Ida Skidder. So what happened subsequently when Paul Brand returned back to US, he actually passed on the message to his subsequent period, which is called, who is actually Ernest Paul Fritchie. He actually was taken over all the further plans on how to develop leprosy and treat therapies. So that was followed out by AJ Selvapandian, who actually subsequently took over all the activities which were being done for the leprosy and this reconstruction. And subsequently, there was another person called Anders Storm, which we actually could not able to find his photograph or any of his details, because he actually worked as a volunteer in CMC VELLORE without any remuneration, but he actually worked along with family here. So we were not able to put his photograph. So subsequently, what happened, there was a hiatus for 20-30 years. And when Dr. Abraham Joseph and Dr. Vijay Araldas together were able to combine with endocrinology department to train people across India to develop the skill and empower them on treatment of diabetes footwear, foot care, and also offloading, etc. And in view of that, we were able to train up to 200 doctors and surgeons as well as a technical person across India. So subsequently in 2007 and 8, Dr. Ali Foster is a podiatrist from United Kingdom. She came over here and trained our diabetic educator in 2007 and 2009. And she passed away in 2011. And she had continuously had an association with us over the years. And 2009, we had the first clinic started, and officially we had a multidisciplinary approach started in 2011 with diabetic educator as a backbone, vascular surgery, physical medicine, rehabilitation, orthotics, which is our greatest backbone, and physiotherapy, surgery, and off late we had even an MDT with plastic surgery too. So our footwear and manufacturing division is the greatest strength. We know that the TCC was pioneered in 1948. One of the interesting story about TCC is that this is the best therapy for any patient with diabetic foot ulcer, but it was never patented by Paul Brand. It has been given free to all over every patient with diabetes and foot ulcer. It was not patented. I don't know how many of us will think of not patenting and inventing a new product. And even microcellular rubber, we have never patented, and it's been used across the globe. So this is how we trained the doctors, surgeons, as well as technical persons or an orthotics, or even we have come across people background of physiotherapists come and get trained here in multiple activities in terms of empower themselves with their resources across India. So this is our diabetic educator who have been, half of them are trained particularly in foot care to help us in our foot clinic as well as in empowering our patients as well as the staffs across India. So what we thought is Harvard is plentiful, but workers are less. So that's why we thought, how come we can spread the good news? So we had a dedicated foot training program which started from 2017 and 2018, and through that we were able to train around 200 physicians or surgeons across India. So we are not stopped at that level because subsequently the Chittoor campus was started. So when we audit our patients, we found that around 30 to 40% of our patients cross the border and come here to VELLORE campus for a foot care or a foot therapy or an amputation or a offloading device. So from 2019, the Chittoor campus integrated diabetic foot clinic was started along with Professor Suranjan as well as Babish was there at that time, and we had a very good orthotic division which they actually think of innovations. So they made in-house footwears, offloading devices, and one of the new innovation was PTP Walker, which has been designed by the orthotic technicians, Mr. John there, and it is in the verge of going for a patent. So it is all over the years. And so that is how the diabetic foot came out, that all through the years and all the details which were collected, and also the authors, if you can see the authors list goes at least over last 20 decades of people who worked or lived here. So that is how it happened. And a big thank to all my teachers, colleagues, as well as allied departments who are able to come up with this particular book. And not the least, we have multiple videos which has been shooted across over the last 10 years, and it's been uploaded for the sake of patients and also the patient care. And thank you for patient listening. So
Friends, can I start by saying how full of gratitude my heart is for multiple things. First of all, for the remembrance that this occasion brings about our dear friend and revered colleague, Sunil. His life and example still inspires us. And when I see his picture, I get goosebumps because he had such a wonderful influence on all of us. And thank you, Indira, for being here as a living embodiment of what he stood for. I also want to, of course, express my deep gratitude to Nihal and Felix and the entire endocrinology team, as well as the surgeons and the PMR department, Bobina, Anand, Rajdeep. Thank you for allowing me to join you on this amazing journey. The third reason for my heart being full of gratitude is, of course, our patients. They're so trusting and so caring as we try to discover better ways of solving their problems. Nihal would have told you perhaps that one patient, I think, walked, Felix, was it 30 kilometers to come to our foot clinic during the COVID crisis? Can you imagine what kind of devotion that requires and what kind of trust? It's almost like going to a temple on a pilgrimage. And of course, he walked with a diabetic ulcer, so that doesn't speak very highly of our teaching him not to walk on his ulcer, but he wanted care. And when there was no transport available, he actually walked 32 kilometers to come to our clinic. And the last but not the least, I want to say thank you to our dear institution. Not only the amazing founders that Felix spoke about, I just want to add that Dr. Mary Verghese, who founded the PMR department, you know where her first job was? Of course in OG, but after she became paraplegic, her first job was with Dr. Paul Brand in the hand surgery department. So she was admitted in the old M ward, and where the electrical engineering department was where Dr. Paul Brand used to see his leprosy patients. You remember then it was illegal to have leprosy patients in the main hospital because they were not allowed to come to the main hospital. But she could see him run his clinic just across the M ward room where she was admitted. And so when she was really down and out because she was wondering whether or not she could go back to clinical medicine, Dr. Paul Brand, who was her surgeon, said, "Why don't you come and help me in the hand surgery, in the leprosy clinic across the way?" And he says in his book that her going to that clinic was electrifying for the patients because they thought that they were deformed, but compared to them, she was so much more seriously affected. And she had injuries to her face, which left her quite badly scarred. Despite that, she was gung-ho. She began to operate from her wheelchair. And so rehabilitation in CMC, because of Dr. Mary's amazing brilliance and the way she was led by God, has always had a surgical slant to it, which has made many people who visit the rehab department here very envious of the width that we are permitted. And that's another thing I want to thank the institution for, because of its enormous generosity in giving us that freedom to do the best that we can for our patients. Now, our institution doesn't only consist of patients and faculty and staff and administrators, but also students. And here I want to say a special thank you to the batch of 1995. 3 cheers for that incredible batch, because they gave the PMR department in Chittoor something like 56 lakhs of rupees to equip ourselves so that we could actually buy the equipment that we wanted to buy to take the diabetic foot care to the next level. So isn't it an amazing organization? We have outstanding people like Sunil, students, patients, and faculty. And this amazing institution gives us this platform to do this. So thank you to each of the wonderful administrators. You have a wonderful heritage, and you're doing such an amazing task of keeping this going. Now, I had promised Nihal that I'll not just gas and fill you with stories, but talk a little bit about science. And so I do want to say a few things about where I think the diabetic foot clinic can go in the next few years. Now, these are an old man's dreams, and it's very dangerous to give the mic to a garrulous old man because he'll bore you with stories. But I'm really excited, and I'm full of excitement, and I hope that I'll be able to transmit that to you. Now, we learned from Dr. Paul Brand the magic of offloading and TCCs, and I don't have to tell you anything more about those. But he also taught us another wonderful fact, just because he handled the foot, he touched it and examined it carefully. And that is, he taught us that the foot gets hot before it begins to deteriorate. And this thermal change in the foot is something that we've been trying to explore. There have been theses and other research things done on it. And so when the WHO generously said, "Can we give you some money?" we said, "Please, will you give us some 15 thermal cameras, very inexpensive ones, digital cameras on which you can stand and it'll immediately draw a map of your foot." These are said to be like glucometers for the foot. And we thought that if we have that, then maybe patients can stand on that every day and check if their feet are injured or need attention. Because the difficulty with a anesthetic foot is that you don't know when it is injured. We, of course, teach patients who have spinal cord injuries to feel their tissues to see if it's warm. But in diabetic neuropathy, which affects the hand and the foot, that is not easy. And of course, diabetics have difficulty with vision. So for them, we were wondering how we can overcome these various difficulties and get them a clinical tool that they could use to see, I walked too much today, and I better take some rest, or my foot is unhappy with the jumping around that I did. So we began to look for that. Of course, the WHO didn't send us what we want, but we are still working on that. The next thing we thought we'd do is to bring in early NCVs and accurate evaluation of what the nerves are doing in the diabetic foot. Is the problem in the diabetic foot just sensory, or is it also motor? because Paul Brand very famously showed us that the ordinary foot is constantly adapting itself. It's changing its shape. So different parts of the foot are getting stressed with every step. He did these experiments in M ward. He made them walk around because it was a square. He put homemade transducers under the foot. He just took 2 bits of foil, ordinary kitchen foil, put a bit of sponge in between them, and that becomes a capacitor, because when you press when you stand on that sponge, it becomes narrow, and the distance between those 2 conductors becomes less, and if you step off them, they become far. So he did all this with almost no research money from DBT, DST, ICMR, whatever. He just used his ingenuity. So he showed us that the foot is actually changing shape, and so that initially it may be the getting warm under the great toe, but after he continues to walk, it is under the second toe, and then the third toe, and then the fourth toe, and then when it then comes back to the great toe. So the intrinsics of the foot have a very interesting function. They not only are sensory muscles, because we think of muscles as being only motor units, but some of these muscles have huge numbers of sensory fibers coming from them. And it's Dr. Marcus who taught us that some of these muscles are sensory muscles. Okay, why do you need a large muscle like the flexor accessorius just near the ankle, or the popliteus just behind the knee? It can't be for power, because it's too close to the fulcrum to really produce a lever. They've probably got a sensory function, and there's something that's going wrong with the sensory function of the foot that makes the foot vulnerable to injury. And so we want to see, is it that, or is it an autonomic dysfunction in the foot that is producing an altered response, which is maybe the reason for it getting warmer before it begins to break down. So we thought we'd try to use EMG to accurately study the foot. And so in the consultation room now, we have an EMG. We also have a wonderful musculoskeletal ultrasound machine, because the foot, when it gets injured, we can't make out, is the injury a little hematoma? Is it has he twisted a little metatarsophalangeal joint, and is there a traumatic arthritis? Because if you can pick it up, X-rays are not good at telling you what's happening to the soft tissues, but with the ultrasound, you can immediately see, there's a little traumatic arthritis. We aspirate the joint, and you can prevent ischemia. Remember, in the fracture neck of femur, it's an unusual fracture because the capsule is tight, and when there's a hematoma there, the blood supply of the head gets cut off, and that's why it's such a special fracture to which you have to attend to immediately. Like you said so beautifully, it's a leg attack. The fracture neck of femur can't be ignored, and you cannot operate on it 3 weeks later. You have to operate immediately, because that head will get dysvascular, and you have to intervene. With this musculoskeletal ultrasound, we could actually aspirate a joint, get a bit of pus from a tendinitis, get early cultures, and intervene. The other magical thing about the new ultrasound machines is that they have a function called elastography. And with elastography, you can actually make out damage to nerves before the NCVs get altered. And because in the NCVs, you're looking at the fastest conduction, and your axon may be damaged, but if the Schwann cells are fine, you'll get normal conductions. But the nerves can get stiffer when they've been injured. Why are we looking for injuries? Because we are wondering, diabetes produces damage to both the feet because it's of peripheral neuropathy. But the Charcot's foot seems to sometimes be unilateral. Is it more than just peripheral nerves that are being involved? Is it possible that there is a tarsal tunnel syndrome in some? And we found this in leprosy. We found that very severely damaged nerves, if you can pick it up early and do a neurolysis, you get back protective sensation in that foot or in that hand. So it makes a huge difference to be able to diagnose that ischemia or relative ischemia early and intervene. So in fact, I'm happy to report that we have picked up the first swollen tarsal posterior nerve in the tarsal tunnel just a couple of weeks ago. We'll have to see if this is commoner and whether these can be treated. And we know that if we can bring back some protective sensation to a foot, it's the best thing that you can do for a diabetic. And of course, treating the diabetic foot is really important because not only is that required for his daily earning his living and going from one place to the other, but it's also important because you need to exercise is such an integral part of the management of diabetes. And when the person's foot is injured, it's harder to manage the diabetes. I have a few other things that I'll quickly rush through. We began to we've just got a force plate, for instance, in the Chittoor department, and that's again a magical bit of machinery. The first one that we bought in the Gate Lab in the main hospital cost us something like 32 lakhs, but we've got one for free from our bioengineering department. And I'm just saying this because I want to let you know what a wonderful team we have in our organization. And Razdeep and his group have produced this for us, working with IIT Chennai. And it's a stiff metal plate with transducers underneath, which will, when you step on it or you apply a force on it, it will break it down into fore, aft, sideways, and up and down forces. And by getting somebody to jump on it, you can do a test called a counter movement jump, for instance, which tells you how much power, just one jump will tell you how much power there is in the lower limbs, because you have to jump up against gravity, and that becomes a good predictor of what the lower limb function is. And we know that if there's good muscle function, there's good blood supply, and all the other advantages of good leg muscles. So these are just some of the ways we are struggling to try to understand the diabetic foot better, and we are really excited about the possibilities. Although the foot is, as Nihal pointed out, often neglected and forgotten, let me remind you that if the thumb is what makes us human, the hand would not have happened if the foot hadn't adapted. The foot had to adapt first so that we could then get off our other hands. And the adaptations. It had to produce arches so that the blood supply could go to the bottom and supply the rest of the tissues. It had to become mobile and stable at the same time. So the mortises where you get mobility, get stability, and the muscles which provide mobility. So it's a wonderful creation. I think it was Einstein who said that when I see the human thumb, I know that there is a God. I would add to that and say, when I look at a foot, I think that it provides the basis for the thumb, which provides the basis for us being human. So the foot is a marvelous, marvelous creation. And although it's low down, it's the part that on which we stand. And therefore, I urge all of you to continue to work to get better solutions for the diabetic foot, so that not only will we improve the lives of the diabetics, but will improve the lives of all of us here. Thanks very much.
Thank you, Dr. Felix and Dr. Suranjan, sir, for those wonderful words and insights into the diabetic foot. Now for the moment that we've all been waiting for, the official book launch. And for this, may I invite the following faculty to come forward. Dr. Indra Agarwal, Professor and Head, Department of Pediatric Nephrology. Dr. Solomon Satish Kumar, Principal. Dr. Prasad Matthews, MS. Dr. Vatsala Sadan, Dean, College of Nursing. Dr. Bala Sita Raman, Nursing Superintendent. Dr. Shukriya Naik, sir. And Dr. Ashish from Plastic Surgery, sir. Nihal, sir, and Felix. Thank you all. May I now request Dr. Indra Agarwal ma'am to speak a few words.
Good evening, everybody, and thank you for this great honor. I stand here feeling really honored, proud, and also very humbled at this great gesture. It's almost 2.5 years since Sunil left us, but I think we still remember a lot of the good things that he's done for us. And I mean, every day I come across somebody who talks something about him, shares some memory about him in the way in which he has, interacted with them or touched their lives. And so the memory lives on. And though, his passing has been a great loss to us as a family, for my children, for the extended family. But I think I've begun to realize what a great loss it has been, not only to us, but also to CMC, to the community at large, to his students, to the vascular unit, and to everybody. And I think, so I really hope that all of us, our family, and the students and the vascular unit and all of them will continue to remember all the good things that they lived, learned from him, and the way he lived his life, his humility, his humanity. I think those are the things that I think we should remember and take with us. I also want to remember at this point, especially regarding, since we're talking about the diabetic foot, Dr. Bhushanam, because Dr. Bhushanam was his mentor. And actually, Sunil was a very, very special person to him. He was also his GO, but more than anything else, I think he was very, very, very fond of Sunil. And he used to say that Sunil is like my son. And on a lighter note, they would even say that I think on rounds, Sunil would actually prime the PGs. This is what I heard from them, the PGs and the consultants on when Dr. Bhushanam is coming on grand rounds, what they should say, what sort of questions they would ask. And many times, if they said something, some major blunder, and Dr. Bhushanam would scream at them. So all they had to say was that Sunil said this. And so after that, all would be forgotten and forgiven. So that was the special relationship that Sunil had with Dr. Bhushanam. And Dr. Bhushanam mentored him over the years. And I think I just day before yesterday, I was talking to Dr. Suviraj, who was one of her alumnus from CMC and the surgery department. And he actually flashed something by me and showed me his thesis, which is on peripheral vascular disease in patients with type 2 diabetes and the diabetic foot very particularly. So this was probably done sometime in the mid 90s. I'm not sure exactly which year. So that actually brought me to think. I asked him who was the guide. So he said it was Dr. Bhushanam, and of course Sunil helped with that. So probably that's how far behind this. As a vascular unit was actually started by Dr. Bhushanam, I think, and I'm not sure about Dr. Fenn probably was also involved. But probably the interest in the diabetic foot probably started as way back as then. And so over time it evolved. And I think, as mentioned in the history, probably sometime in the early 2000s, it probably evolved into a clinic. And I know that Sunil used to talked about this diabetic foot clinic, and it was very dear to it. And he was very passionate about it. So I'm very happy to see that it has, it was nice hearing about the history and the way it has evolved. And I really congratulate Nihal and Felix for bringing out this book. I'm sure that it will help a whole lot of people. It shows how beautifully shared care can be done. And I'm sure it'll be useful for many people all over. There's another thing I'm just remembering. Soon after Sunil passed away, there was a chaplain from another, I think some part of Kerala, where he especially rang me up. I don't know where he got it from, but got my number from. But he actually talked about that diabetic foot that he had. And he said he had been to different institutions all over South India, which includes in Kochi, Amrita, St. John's, Mangalore, Chennai, Apollo. But he said it was here in CMC that after months or years of this non-healing ulcer that it got cured. So it speaks volumes for the teamwork that is being done here. And it's not just, I mean, he was remembering Sunil, but it is not a single person's work. It's a huge teamwork. And like Dr. Suranjan said, we are fortunate for what we have. And our the way we integrate ourselves between departments and the shared care. And that's a big example to actually many people. So thank you very much for this big honor that you have bestowed on us as a family. And I would also like to thank them for inviting me here, and also would like to wish the endocrine department and their collaboration with other units all the very best. Thank you.
Thank you, ma'am, for your very touching and encouraging words. May I request our dear principal to address the gathering.
Good evening, everyone. I want to start by saying congratulations to everyone involved in the launch of this book. I can see all the teams seated here, ably led by Dr. Nihal and Felix. Dr. Nihal actually should be sitting right here in front, but we know his humility and character, and he was standing till now in the back, and he's just been seated now. Another thing I'm so happy about, which Dr. Suranjan also alluded to, is that CMC continues to be relevant and continues to respond to the needs of the community around. We know that Dr. Scudder responded to a particular need. We just heard about Dr. Paul Brand, who responded to a particular need. And we have the Department of Endocrinology, who responded to the need of diabetes in the country. And we heard from the story 60-0 from Felix of how diabetic care evolved, not only here in CMC, but reaching out to the nation, and how the diabetic foot care clinic evolved. And now it's resulted in this wonderful book, The Diabetic Foot. And people are always looking for authentic information. And I'm sure this book is got authentic information, and it's going to be a blessing to people around, not only in India, but across the globe. And we remember the words of Ida Scudder, who said, we need people to carry the torch of life. And this book is an example of several people who continue to carry the torch of life. And as we also remember Dr. Sunil Agarwal, who carried the torch of life, it inspires all of us. And especially for the students and postgraduates here, we want them to be compassionate and respond to the needs of people around. How best can we teach them but by examples like this? Responding to needs, starting new clinics, bringing about education material, and this lays the seed inside the students and the postgraduates. So thank you, Dr. Nihal and team, and we wish you all the best for the future as you continue to respond to the needs of people around. Thank you, and I'm so happy to be a part of this book launch. Thank you.
Thank you, sir. Further, to express words of appreciation for the life, work, and contribution of Dr. Sunil Agarwal, may I invite the following faculty. Dr. Deepak Selvaraj, Professor and Acting Head, Department of Vascular Surgery, followed by Dr. Pranay Gaikwad, Professor and Head of Surgery Unit 1, and Dr. Edwin Stephen, Professor, Sultan Qaboos Hospital, who will be joining us online.
Thank you for giving me this opportunity, Nihal. I think this is a very momentous occasion, the release of this book. Hello to Edwin and Venkatesh and all the people who are abroad. There's so many things I can talk about Sunil, but there's not one day that goes when the three of us don't miss him. And so there is everything that happens in my unit, we miss him. There is not one person, not one event that goes without us saying if Sunil was there, it would be like this. So we miss him. That's number one. The second thing is he taught two things for us, for me as such. He said he taught me reverence to our teachers. So in fact, he actually, the first day I came, or the first few months when we came, he taught us how this department started. It actually started 50 years ago when Jeffrey Sheed actually did the first vascular surgery. So we actually in the process of writing a book. Then there was Joe Devadatta, then Dr. Bhuchnam, and then there was David Sadhu, Edwin Stephen, Sunil Agarwal. So, and he taught us how to revere our teachers. That is one important thing. So you know what is Guru Bhakti from Dr. Sunil. So I hope the present generation of students, our principal is here, can actually learn a lot from somebody like Sunil and the way he has actually respected his teachers. In fact, revered them so much. So we still follow that. The three of us really respect, remember every word that he has said. one of the famous phrases that he tells medical students is, common things are common except common sense. So this is when they answer something which is not correct. So other thing he taught about us is from the evolution of this food clinic, you're very obvious that it is a teamwork. And he taught us that in the beginning, around 10 years back when it started, I think Prabhu and me used to go for these food clinics. And after a very busy OPD, we had to go for these food clinics. And we used to come. So we have to go and feel pulses again all the way. And he said, Deepak and Prabhu, the most important thing in this Christian Medical College is teamwork. The strength of this institution is in its teamwork. And if you actually, then he taught us like, you can't live alone. At that time, cardiology used to do a lot of our angioplasties. Interventional radiology used to do a lot of our angioplasties. We weren't doing fistula work and all these things. So we used to depend on all these other units for help. The PMR department. Vascular surgery, he said, is a department which kind of has to help other units as well as work together with all of them. So in podiatry, the clinic that you have started is actually an example of a mini vascular setup. So there are so many other departments that actually come here and something beautiful has come out of it. And I'm so glad that we were actually part of this whole podiatry exercise. I'm sure this will go on to see a lot of, it will just become bigger and bigger. There's no end to that. And I must thank Nihal for his persistence and the way he has actually pushed this whole food clinic forward and his perseverance and to push it for these 10 years and to what it is now. And so these are the two things. One is teamwork. The other one is reverence to our teachers. These are the things that which actually comes to my mind when I think of podiatry and vascular surgery. Thank you very much.
Good evening, friends. It's a privilege to be here. And firstly, about Dr. Sunil, I knew him from Ludhiana time when I was doing my internship. He was in another surgical unit, and I used to see from distance. But unfortunately, that time I didn't get any occasion to work with him till I kind of reached here and joined the Department of General Surgery. Initially, as everybody knows, we were 6 units and he was in surgery 2, which was a vascular and general surgery specialty oriented unit. And that's the time when general surgery was also part of this foot clinic. But at some point, the department specialized, and then that slot for general surgery in foot clinic became a little vacant. And one of my, our head of the unit that time, Dr. John, he then took the initiative and got into this foot clinic, and that's how I got involved initially with that. About Dr. Sunil, I think a lot of good things can be said. What I learned from him was that I remember his objectivity as far as patient assessment and care is concerned. During his tenure as a head of the Department of General Surgery, that time it was not division, it was General Surgery Department. He was the one who introduced surgical audit in the department. And we had a lot of discussions how to go about it and all. And that time I was in surgery 1. So I was in the firing line. Our unit was in the firing line. And because Dr. John asked me to do it, then I had to start doing this audit. It was a difficult one because we didn't know how to go about it. Nobody had any clue how to frame an audit. What are the outcome measures? So it helped us learn. And during the surgical audits, which we still have every month, I think it's one of the most best learning session we have in our department, because that's where we ruminate and learn what went wrong, and we can improve upon ourselves without picking upon each other. That's the beauty of that. So it's a very good community learning for PGs as well as consultants. So I am kind of very, very privileged to be part of that system. Besides that, I think I'd like to thank Dr. Nihal for including me in this endeavor of book. Diabetic foot can present as a chronic condition, or more often it presents in acute situation in casualty. And that's where general surgeons are often called. Now, the challenge for a general surgeon is how less can we do so that rehabilitation can be done. Earlier on, just go ahead and do amputation, patient will live and things like that. But as the understanding has evolved over the years, we have realized that conservatism is the thing that we need to follow so that the patient has a better quality of life. And throughout the years, we are trying to tell the, and this comes out in our audit also, that how many were amputated versus minimally amputated, minor amputation versus major amputation. So that is one challenge we've always had, and we audit it every time, whether we are going too much towards this side. The problem with minor amputations is sometimes it requires multiple procedures. So that is a drain on resource in some ways also. But I think that thin line has to be, thin balance has to be attained. Other than that, I would like to also inform that one of the things our unit has concentrated upon is the other foot. And we call in our language the precious foot or the precious limb, because one foot has already suffered. Now the remaining pressure is actually falling on the other foot, and we have to protect that. So the protective wear not only should go for the affected foot, but also for the follow-up should be for the other foot also. So that is something which we have to look at very carefully and continuously. In fact, the follow-up for, in my opinion, diabetic foot should be like how we follow for a cancer, lifelong, because it's not going to get better with the microangiopathy or whatever other vascular neuropathy, etc. So we have to be following it up regularly at surgical level also and at other levels also. So I'm very honored to be part of this book. Thank you very much and have a good day.
Dr. Edwin Stephen will be joining us online.
Hi, good evening, everybody. It's nice to be part of this special event. And thank you, Nihal, for including me. It's nice to see friends and familiar faces. Greetings to everybody. It is an emotional moment every time we kind of gather like this to talk about Sunil and what he's done and what he's meant to each one of us. I stand where I am today thanks to him for being my mentor for, I mean, how many decades now? 1992 is when I first met him. And as Deepak said, you know, there's not a day that goes by when you see something and you think, what would he have done? So that mentorship, I think, continues. It does bring back a lot of memories, thoughts, and I'm grateful to him for what I am today. Thank you, Sunil. Sunil made us understand vascular surgery as an art and a science. He always encouraged us to think why we did something, analyze it, brought out the researcher in us. He was more than happy to stand behind and push us into the limelight. I was just thinking, if it was him today saying, you know, we are launching the book and it's dedicated to you, he'd say, what, Pa? I am not coming, you guys go. You know, he would shy away from any glory. He always just wanted to be the unsung hero. He was happy with that. And there's a lot to learn from that. He also taught us the balance between work and life. This is at a time in professional work today where everybody is talking about work-life balance. And he showed us how it could be done despite having a busy lifestyle. And the kind of attention he was able to give Indu and the boys, and yet and have time with them, showed us that we could do the same, and he encouraged us to do the same. And that is something that was really precious, some of the things that he taught us on those lines. He always encouraged us to excel, to go beyond, become better than him. He never felt threatened. He never felt threatened. You came up with a a new idea. You went to him. You could discuss with him. He might tell you, this is the way I would do it, and then he'll stand by you. And if you fell, he'd pick you up. And that, I think, has made us better mentors as well. I'm in a land where you see number plates which say HH. It's His Highness or Her Highness. And you know, these are special cars. I think if Sunil had a car, that also should have HH on it. One of the most humble and one of the most humane people that most of us have met. He is a HH to me, and I'm sure he's a HH to many of you. There's this saying that goes, if you know how, you will have a job. If you know why, you can be the boss. Sunil was not a boss. He's a legend. And the legend lives on through what is, as you can see, has been said about him, through us who were his mentees, through other students whose lives he's touched, patients. And not only patients, there were people whose lives he has touched outside of hospital. And so the legend lives on. Deepak was saying about the diabetic foot clinic, and I was also going up at, I put that down as one of the points. So when the diabetic foot clinic started, we'd all be, inundated with work. And then you'd get this call from Nihal saying that, who's coming? And Sunil will say, I'll go, Pa. If you guys are busy, I'll go. And we'd all be in a way relieved that he's going, but then you realize he comes back and carries on his clinic. And so the next time around, he was a person who led by example. And as, again, sorry to be repetitive, but Deepak said, it was about team building. He taught us that. And I think it's very befitting to dedicate this book to a person like him. Nihal and team, thank you for all that you do to increase awareness, to be relentless in your drive, to pay attention to an organ in our body, or the foot, as Dr. Suranjan was saying, which is abused and neglected several times over. So thank you so much. The role of diabetic foot and the clinic has already been alluded to, so I will not go down that pathway. But thanks again for giving me this opportunity, and I wish you and the team all the very best. Thank you.
Thank you, Dr. Deepak, Dr. Pranay, and Dr. Edwin. The legend and the memory of Dr. Sunil sir will surely live on. Today, we are privileged to have with us the distinguished presence of Dr. Usha Titus, IAS, from the batch of 1978. Madam is currently the chairperson and the managing director of the Additional Skill Acquisition Program, Kerala. Madam will pay a few words of tribute to Dr. Sunil Agarwal. Over to Dr. Usha Titus.
Thank you, Indu and Nihal and the entire endocrinology team for making me a part of this great occasion. My batchmates, of whom the whole batch of Dr. Venkatesh, Dr. Wilson, they are there in our midst today. It is always a pleasure to connect with one's alma mater. And today the pleasure is double because the occasion is also one to honor and remember one of the finest clinicians and one of the best human beings I have met in my life. The Bible talks of the faithful and wise servant who is put in charge of the servants in his household to give them food at the proper time. And then Jesus goes on to say, blessed is he whom his master finds so doing when he returns. Whenever I think of Sunil Agarwal, this verse looms large. His patients covered not just those who accessed him in CMC in his department, they covered every patient referred to him for care by anyone under CMC. Dr. Naik was there. He operated on my late father, and it was Sunil who brought us to him. So whenever I asked Sunil, now who is this doctor? I don't know him. Sunil had an absolute trust in and faith in those he worked with in CMC. And he would say that if it were my father, I would trust him. And then there was nothing we could say no to. Till his last breath, Sunil was on the road to take care of those patients in need, which in my belief and thought goes beyond the call of duty. He literally steadied the hands of students under him who faltered, as my nephew, who trained as a surgeon under him, swears by. His foster children covered every child of his batches. Sunil, as has been mentioned by many, was a big team player. And he was willing to be self-effacing as part of this team. While being part of this team, as credit is being taken by some other department in running the clinic. What do the Avengers, A Bug's Life, RRR have in common? Apart from a lot of fun, each of those movies depict how anything is possible if people, superheroes, bugs, can pull together and unite behind a common goal. But the bane of public governance is working in silos. Therefore, there is duplication of schemes and imperfect projects because valuable feedback is never taken. And evidence of one department working in the same sector is never collected. That's why I'm so happy to see this teamwork in action in CMC. The difference between CMC and the rest of the world, perhaps, or rather the world as we see it here, is that CMC is able to attract the best like Sunil and Indu and hold them together. Selfless clinicians need to be honored and emulated for restoring the citizens' faith and trust in modern medicine and its practitioners. The endocrinology department under Dr. Nihal Thomas has done just that. I am sure Sunil is blessing them and us all from heaven with the heaven we host today. Thank you.
Thank you, ma'am, for your very inspiring words. Before we close, may I invite Dr. Thomas Paul, Professor and Head of the Department of Endocrinology, to propose the vote of thanks.
On behalf of Department of Endocrinology, I'd like to thank who have taken time to attend this function, who are online as well as in person. As mentioned by all, thank you all this MDT team for making this fruitful. And thank you administrators. I have to give special, only one thing I wanted to tell was, if I see a new diabetic chart, patient with diabetes, if I don't touch the foot, I feel guilty. That is the habit Dr. Nihal has cultivated in me. So that is the message I want to give. And I definitely remember Dr. Sunil, who used to come to diabetic food clinic, and so OPD, but still he comes, takes care. And special thanks to Felix and for bringing out the book. Thank you all for coming. Thanks a lot.
With this, we come to the end of this book launch session. Refreshments will be served outside.